Today I'll be talking about the history of anesthesia and what 3 different types of anesthesia is used, and the factors that determine which one will be used on people. Okay, so what is anesthesia? It traditionally means the condition of having some sensation blocked or taken away. It causes loss of responsiveness, loss of skeletal muscle relax, decreased stress response, and it's given through IVs, face masks, a tube in your nose or throat, or also as a shot. So in 1880, this guy named Sir Humphrey Davy was the first surgeon to produce anesthesia by using nitrous oxide gas, also known as laughing gas. And he did experiments upon himself, and doing these, he discovered that anesthesia, using the nitrous oxide gas, that it had the power to relieve toothache. But in 1946, a guy named William Thomas Green Morton was doing a tooth operation using this laughing gas, and it failed. So due to the failure, he did experiments upon himself using a drug called ether, and during this he lost consciousness and then woke up 7 to 8 minutes later in possession of the greatest discovery in medicine. So there's 3 types of anesthesia that are the most common. There's local, regional, and general. For local, it's a numbing drug that is injected directly into the surgical area of the procedure. During the local anesthesia, the patients are awake, and they get a relaxant to make them relax and calm down. And it inhibits sensory perceptions into a specific location on the body, such as the teeth. For regional, it renders a larger area of the body by blocking transition of nerve impulses between the part of the body and the spinal cord. And one that's really familiar is an epidural. And you can also do it on your shoulders, your legs, and your spinal cords. The general anesthesia is the one that is most common, inhibiting of sensory, motor, and sympathetic nerve transitions at the level of the brain. It results in unconsciousness and lack of sensation. It is administered into our veins by an IV. And the purpose of the general anesthesia is the loss of response to pain, the loss of memory, and the loss of consciousness. So there are 6 factors that determine which one will be used on the patients, and the procedure itself is the major one because most procedures cause patients to be unconscious, so it'd be the general. And then the patient's preference, if you can be unconscious or conscious, then you have a say in which one you would rather do. Age is also very common because young children would get the general anesthesia for things adults wouldn't have any medicine for, such as an MRI, because they don't really have an explanation for the MRI and they won't lie still, so the MRI wouldn't work. Medical history has a huge part on it, such as like heart problems or diabetes, your current medical condition, and the anesthesiologist has a say in what he thinks is best. So in conclusion, anesthesia makes a lot of the operations and procedures performed today happen, and it has a great impact on our medicine in this world. And those are my references. An epidural is during labor.
See how long this movie was?
That's what you said.
No, you can get the regional, you can get procedures on your shoulder with the regional, or an epidural.
I was like, what?